Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture is basically an eating disorder which is known as anorexia nervosa. So what happens over here is it's basically a delusional disorder in which the patient thinks that he is overweight and he restricts his eating habits during this disorder. So that we'll be discussing over here in this lecture. The sections basically consist of the eating disorder itself. How do we score this pathology? The SCOFF scoring questions are again very important over here because we have to differentiate this pathology from a normal condition which can arise during the thought process of even a normal individual. So the anorexia nervosa, how do you define this condition is again very important because there is a specific criteria that suggests that the person is suffering from the anorexia, or it's also known as an anorexic nervosa condition. The history taking again is very important. It's a very important component for the assessment of the patients. The risk factors, obviously, they'll be discussed over here in this section, which basically includes the environmental factors as well as the personality traits of the person himself or herself. In the second section, we'll be discussing the anorexic symptoms. So how does the patient clinically manifest? It's again very important. What are the signs and symptoms? What will be the common complaints that the patient will come up with? That will give you an idea about the thought process that is going on behind all this delusional phenomena. The prodromal features will be discussed over here in this section, and then we'll be moving on to the central features of this pathology. The psychiatric comorbidities can coexist with this condition, and obviously that will highlight the fact that a single psychiatric problem doesn't exist solely. There is a history to it. So we'll dig that out during the investigations, and that will give us important clues about the pathology of that person. The psychiatric assessment will be discussed in the third section. After you have diagnosed the patient that he's suffering from anorexia nervosa, how are you going to go about it? What is the assessment of that patient being done? First, health service contact is approached, and after that, the psychiatric assessments and the physical investigations are carried out just to have the proper management guidelines for that particular patient that we're dealing on with. Then we'll moving on with the complications and the differential diagnosis in that particular case. So it basically differs from case to case. The differential diagnosis will differ, and even the complications are going to differ depending upon the comorbidities that exist in that individual. In the fourth section, we'll be dealing with the anorexia in children. So even the children can present with these particular kind of psychiatric disorders, these mental disorders, and they can effectively render their normal day-to-day life. So it's again very important to diagnose these cases on appropriate time and treat them accordingly. The etiology will be discussed over here in this fourth section, and then we'll be moving on to the symptoms and the treatment that is given for these children. The anorexia in males is again another variety that is present, and we have to diagnose it as well. In the last and in the fifth section, we'll be discussing the treatment of anorexia. So what are the common treatment modalities? Obviously, counseling sessions are there, but we'll be sometimes involving CBTs along with the pharmacotherapies for particular patients. So the general considerations are taken into account over here, and then we'll be moving on to the counseling sessions. How are they carried out? What is the focus of these counseling sessions? And the psychotherapies will also be discussed over here. The medications along with the compulsory treatment and along with its outcome is again very important over here in this section. So I hope you want to learn more about anorexia nervosa. So do watch the other sections of this lecture as well.